Greetings and welcome to this learning session. This session will include exploration into communication and conversations, as well as strategies to build both of these skills within your child. Upon completion of this learning session, participants will be able to summarize the communication or social skills presented, explain the steps to teach within each skill, and distinguish how to teach the steps. This is today's agenda. This will include the examination of autism and how it may impact communication overall. I will also discuss communication characteristics, communication systems, and communication strategies. In the last section, I will discuss conversations, steps involved in conversations, and how to teach these steps along with some conversation strategies. Let's begin by first examining how autism may impact communication. According to the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-5, autism spectrum disorder is a neurodevelopmental disability that is a dyad of symptoms that may include challenges in social communication and interaction and restricted repetitive behaviors. I am going to focus much of today's workshop on the social communication and interaction side of the dyad and how this side can be supported with specific communication supports and strategies. Social communication and interaction may include deficits in social-emotional reciprocity and non-vocal communicative behavior. For example, an individual may have a difficult time maintaining a conversation, or the conversation may tend to be one-sided. The individual may not understand non-vocal communication, such as body language or gestures, or they may have a difficult time picking up on tone or voice meaning. Possible deficits in social skills may include an individual's ability to develop and maintain relationships, understand friendships, or distinguish inappropriate relationships. There may also be an inability to share enjoyment with others. They may be more focused on what is enjoyable to them, and they may not notice when someone is trying to gain their attention. These characteristics may make it challenging for an individual with autism to display socially acceptable and appropriate communication and social skills. When discussing the developmental delays related to autism, theory of mind can fall into this conversation. Theory of mind, which develops in a child's preschool years, refers to the ability to understand that another individual's perspective differs from yours. The development of theory of mind takes place throughout childhood in a predictable manner. Understanding that people do not always want the same things and act in a variety of ways to get the things they want. Understanding that people may have differing beliefs about the same topic or event. Recognizing that everyone's access to knowledge is different, and if they have not seen it, they may need additional context to understand. Recognizing that different people may have false beliefs that differ from reality, and understanding that people can hide their emotions and feel a different emotion than the one they are displaying. The development of these theory of mind concepts eventually leads to children becoming better at another key social skill, perspective taking. When there are deficits with the development of theory of mind, the skills necessary in conversations may be affected and will therefore need explicit instruction and guidance to manifest the related skills. It may be imperative to focus on these skills for your child. Although many of us picked up nuances and untold behaviors to beginning and maintaining a conversation, Many of our individuals with autism need to learn more explicitly because they may lack the skills to observe and simply apply what they are observing or feeling in an interaction with another person. Processing time is another area that may be considered when supporting individuals with autism and their conversation and communication skills. Processing time involves the 5 senses: short-term memory, working memory, long-term memory, and a response. The message provided to an individual enters through the senses and then travels through each of these components of your brain before it can be processed to create a response. People with autism, at times, these stages may be delayed. This is important to consider when communicating with people with autism. Sufficient processing time should be considered before repeating a request or deciding to disengage. If the stages are interrupted, the person with autism may need to begin again navigating through each stage all over again. In other words, an interruption effectively wipes away any intermediate result, confronting the person with autism as though it was the first time with the same request. For example, when initiating a conversation with an individual with autism, if the person does not immediately begin speaking in a response, a second request through the same as the first is received by the individual as a brand new request. And now the attempt to process both requests and the desired response has not occurred. Delayed processing in people with autism, in less extreme cases, can take seconds or minutes. Sometimes it has been known to take weeks or days, and in most extreme cases, it can take years to process what is being said and to formulate a response. I found this quote by Mark Sundberg particularly interesting as a proponent to consider using the following supports and strategies to build communication skills for your child. I will now transition to discuss communication, and specifically the characteristics regarding expressive and receptive communication, communication systems, and strategies for communication. Communication is important in teaching people to express themselves, their opinions and ideas, as well as their wants and needs. It is also important in understanding what others are saying or understanding events and activities. Communication skills are needed to facilitate learning and engage in meaningful exchanges with others. Expressive skills are vital to telling others what they want and need, sharing information and opinions, and having dialogue or conversations. Receptive skills include the person's understanding of what others are telling you. Communication that is functional to the person using it means that they have the ability to express their wants and needs in a socially acceptable and appropriate manner, either through verbal or nonverbal means. All communication should be purposeful or meaningful. Everyone has the right to have a system of communication. These systems can come in different forms since individuals communicate in a variety of ways. These systems may include facial expressions, vocalizations, writing or notes, eye contact, such as emotions, gestures, greetings and farewells, use of an alternative augmentative device or an AAC or another piece of equipment, and pictures or drawings. It is important to determine the best communication system for your child. A communication concept to consider using includes communicating with language that is clear and concrete. Clear and concrete language is specific and tangible. These are words that we experience through our five senses, while abstract language uses intangible ideas or qualities. Abstract language may have different meanings for different people, which can make it difficult to understand ideas such as gentle, independent, or love. There are two examples on this slide. The first shows word examples from abstract to concrete. Transportation to vehicle, using a vehicle as a means of transportation. Car as a type of vehicle, to Billy's car, which is more specific. The second example is a sentence describing the time that Mary had outside. An abstract sentence may read, Mary engaged in physical activity outside, while a more concrete sentence will state exactly what she did. While on the playground, Mary kicked a soccer ball in the grass field. Use of this concept will help to build a supportive environment that is consistent and predictable. Here are additional examples of concrete versus abstract language. For example, stating that an activity will begin at a specific time, such as 8 a.m., versus simply stating in the morning. Another example is when giving instructions or directions. Specific directions would be to put your clothes in the hamper versus simply saying clean your room. A final example is telling someone what to do when their friend is crying. A concrete example is to tell them to give their friend a hug when he is crying versus simply telling the individual to show sympathy, which is more abstract. Visual supports are very effective that can be used to assist your child in understanding receptive communication and expectations through use of a visual. The image on the left depicts a stop sign to signal that the cabinet is off limits and that your child should not access it. The image in the middle is a visual schedule to help your child understand what the routine is, making it predictable and consistent with the concrete pictures found on the schedule. The image on the top right is a visual to assist your child in understanding where their snack and drink may go on their tray or plate. There are also some expressive visuals on this image as well to assist them in being able to respond and request appropriately. And finally, the image on the bottom right is called a task analysis, which is a set of skills displayed in their sequential order of completion. This example shows the steps involved in conducting the steps of the bathroom routine appropriately and in order. Visuals may also be used for expressive communication as a means for your child to express their wants and needs appropriately. The image on the top left displays a visual of icons and words to assist your child with playing tic-tac-toe. The image on the bottom left is a menu with pictures that can assist your child with ordering food at a restaurant. The yes and no icons in the middle are visuals that your child can use to respond to a yes or no question. The image on the far right is another visual of icons and words to assist your child in playing a board or dice related game. All of these visuals assist your child in being able to respond, initiate, and comment with expressive communication. This slide displays several other visuals that can help facilitate expressive communication. Your child could use the break and the help icons to signal when they are needing a break or help. The words in the middle could help facilitate other wants and needs that your child may have. Next, I will discuss conversation, including steps within a conversation, how to teach the steps of a conversation, and other conversation strategies. The steps within a conversation include greeting, initial comment or question, conversation exchanges, wrap up, and conclusion. I will discuss what occurs in each of these steps over the next few slides. The first step of a conversation is a greeting. Greetings can occur in a variety of ways, from saying hi to giving a hug. Greetings can also be broken into steps and visually represented. The steps within greetings that are represented in the visuals on the right are approach the other person, gain the other person's attention, and then deliver the greeting type, such as a verbal hello, hand wave, fist bump, high five, or other method of greeting. The second step of a conversation is an initial comment or question. These comment or question examples can be used as a lead-in to further a conversation with another person. The third step of a conversation is the conversation exchanges that occur between the people involved. There are rules that are necessary for the exchange to continue. These rules include taking turns, staying on topic, asking related questions, and making comments about the topic. The fourth step of conversation is wrapping up. This serves as a segue to the end of the conversation. The final step of a conversation is the conclusion. This is the finality of the conversation. Now that you know the steps involved in a conversation, let's talk about how to teach the steps. There are multiple strategies that you could choose to teach these steps of a conversation. These include visuals or scripts, modeling, video modeling, and social stories. The next few slides will discuss each of these strategies. The first strategy is visuals or scripts. These tools assist in describing the options of what to do in a social situation. They not only depict the step, but may also provide options to the learner for use within the conversation. Visual comment reminders assist in maintaining conversations and reciprocal interactions with others. This slide shows examples of visuals that can be provided as a support when making comments during a conversation exchange. The second conversation strategy is modeling. Modeling is when a desired behavior is demonstrated, allowing for it to be imitated by another person. Modeling can be used to teach many skills, including social skills. An example of modeling can be seen in a greeting exchange. Your child is passing an individual in the grocery aisle. The other individual says, "Good morning" to you as the adult. You respond, "Good morning." The other individual then says, "Good morning" to your child. You model the correct response with a prompt. Say "Good morning." Your child says "Good morning" to the other individual. As your child progresses, you will begin to withhold your prompting of your child with what to say to the other person. The next strategy is video modeling. Video modeling can be displayed in steps or the whole task. If it is shown in steps, the person would watch the step and then attempt to model the step demonstrated in the video. If the whole task is shown, the person would attempt to model the whole task once the video model concludes. This slide shows a variety of videos that are online to assist you with this strategy. Here are a few videos that you can cut and paste into your web browser to consider for use with your child. Social stories is another strategy. These are teaching tools that are person-centered and depict the details of a situation that the person is experiencing. The social story can either be read to the person with the person following along with the assistance of the pictures, or the person can read the social story to themselves. Usually, social stories are read just prior to the activity to be a guide for the person's behavior. The example on this slide is the step of greeting. Now that you know the skills and options of how to teach conversations, I will discuss when to teach and practice these skills. There are multiple ways to practice social skills via structured and unstructured or incidental ways. Structured sessions are designated times in the day or schedule in which specific skills can be taught and practiced. Some examples of these times could be during meal times, with a sibling or other family member, or reading a social story prior to an activity. Incidental or unstructured sessions are more naturalistic times or moments when skills can be practiced. These times could be when someone knocks on the door, during an outing, or when passing a neighbor on a walk in the neighborhood. So how do you get more out of these skills? This is where positive reinforcement comes in. I will discuss how to reinforce the steps to make them stronger and encourage your child to use these skills more often. Let's first examine what a reinforcer is. We know we are motivated by different things, and so are our children. Therefore, it is important to ensure that reinforcers, or sometimes called rewards, are individualized for each of our children. When determining reinforcers, ensure that the items, activities, tangibles, etc. that are chosen are highly reinforcing so that when they're used, they will likely work to increase the desired behavior. Be sure to create activities that incorporate your child's interests. Reinforcement should be person-driven to ensure they are motivated. You will have more buy-in from your child if you incorporate their interests and motivations. There are a variety of reinforcer types, from social to edible, as seen in this chart. This chart displays the different reinforcers that can be used as reinforcement. Reinforcer options should also be age appropriate. Now that you know what a reinforcer is, I want to briefly discuss how to use a reinforcer in positive reinforcement. Positive reinforcement occurs when a statement, item, action, or activity is presented immediately following a behavior that then makes it more likely that that particular behavior will occur again in the future. This event, item, action, or statement that is added after the behavior occurs, as we know, is called the reinforcer. I will show you positive reinforcement in action on the next slide. Positive reinforcement is vital in general towards the acquisition and maintenance of skills. There are two main ways you can use reinforcement to motivate and strengthen your child's social and communication skills. This slide shows reinforcing the whole chain of skills: approaching another person, gaining their attention, and then saying hi or another greeting. After this whole chain is completed, you would then reinforce your child with a motivating item. I will discuss the other way to reinforce your child on the next slide. You may also decide to deliver reinforcement after each step of the chain of the skill. Once your child approaches another person to greet them, you would either verbally praise them by saying, "Nice job going up to Sam," or provide them with a quick edible reinforcer. Then, once your child gains their attention, you would praise them or give them a reinforcer again. And then finally, once they say hi or deliver another type of greeting, you would praise them or give them another reinforcer. Once your child masters each of these steps of the skill, you would look only to reinforce them once at the completion of all steps, and then continue to fade the delivery of these reinforcers over time. So maybe only after every other greeting, and then after every third or fourth greeting, and so forth. If you choose to focus on just one skill within a step or one step at a time, it is important to then move to teaching and reinforcing the next step of the skill to continue the learning process. Once you see mastery and independence within each step of conversation, you may decide to reinforce your child after all of the steps involved, from greeting through conclusion. Some examples could be to deliver a verbal praise statement such as, "Nice job having a conversation with Sam." Maybe a tangible reinforcer such as extra time on iPad, or you might be able to have a dessert of your choice. There are several techniques that can be incorporated to allow your child to practice the skills. These techniques include allowing extra time to formulate and express their responses. Some children need extra time, as we know, to allow for the formulation and expression of their response. Allow your child time for their responses to process. Recommended processing time is 10 seconds. Providing opportunities to ask questions and initiate and maintain conversations is critical. Creating opportunities to practice social communication is vital. This can be done in a variety of activities requiring children to ask questions, initiate and maintain conversations, have verbal and nonverbal interactions with others, give sufficient information, use prompting, give cause and effect information, use language to make choices and also express their needs, understand dangerous situations, including outcomes and consequences, use problem-solving and decision-making techniques, brainstorm solutions with peers, practice with peers, and role play with peers. Role-playing specific social language situations with basic social skills emphasized, such as greetings, body language, and spatial boundaries, are important. Role-playing is a strategy that allows for practice of communication and social skill scenarios with others before doing them in real time. Some examples of role plays include practicing how to ask another person for directions, ordering and paying at a restaurant, and using appropriate behavior when walking through a store. When role-playing, basic social skills can be emphasized. For example, greetings, salutations such as hi, what's up, hello, bye, and see you later. Eye contact, teaching your child to look in the direction of the speaker's face during a conversation. The use of polite form, teaching your child to engage in appropriate manners as needed, such as please and thank you. The use of body language, teaching your child to understand others' body language and non-vocal communication. And spatial boundaries, personal space, and what is socially acceptable in various situations. As we conclude today's session, I want you to first reflect on whether or not your child has a functional means of communication, and then consider which skill or step you want to begin with, and which method you will consider using to support your child with learning the skills around increasing their ability to converse with others. Thank you for taking time today to join me in today's learning session. Please contact Autism Resources at autism.resources at doe.k12.de.us if you have any questions related to today's presentation or would like additional information or support in implementing any of these strategies in your home.